Johnson & Johnson's COVID-19 vaccine and those reports of blood clots. Earlier today, I asked Dr. Purvi Parikh about this and about what researchers are doing for people recovering from the virus who are also dealing with brain fog. Dr. Parikh, thank you for joining us. I think top of mind for so many people right now, if they received the Johnson & Johnson vaccine, what should they do?
They should not panic, first and foremost, because out of the close to 7 million doses already administered, only 6 cases of these blood clots have been confirmed. So that's literally more than 1 in a million. And again, people need to remember that overall people are fine, and it's much more common to develop blood clots from actual COVID-19 itself. So the benefits of the vaccine still far outweigh any risks.
With that said, what are some of the symptoms people should look for in terms of complications with this vaccine or any of the others?
You know, in this particular case, if there was a clot, it was between 6 to 13 days. So common signs and symptoms in that window might be leg pain or swelling, shortness of breath, if you might be getting headaches. Overall, you know, most of the vaccines, at least in the clinical trials, showed that they didn't have any serious side effects or permanent side effects. Of course, common things with every vaccine might be just the normal immune reaction, meaning fevers, chills, arm soreness for a couple of days after the vaccination.
Other than the fact that it's a one-shot dose, the J&J vaccine, what makes it different than the other vaccines currently available?
It's a one-shot. The nice thing is that it can be stored in the normal refrigerator, so it's much easier to roll out to certain areas that might not have the deep freeze that's required of some of the other vaccines. And also, it's a different technology than the Moderna and Pfizer vaccines. Those both are mRNA vaccines, and this uses a different way to deliver the information to your immune system, something called an adenovirus vector, meaning an inactivated common cold virus is what the vehicle is to bring that information to you.
Do you believe this will be a temporary pause? This vaccine will be available again soon?
Yes, I think so. I think it's very similar to what we saw with the AstraZeneca vaccine globally. And even the mechanism may be the same because both of these vaccines use the same technology. And again, even in that case, they found it was exceedingly rare. There was no direct cause, a possible link. And again, all of the benefits of the vaccine far outweigh the risks. It's actually much more common to get blood clots from so many other things, like cancer, birth control, a variety of other illnesses like obesity.
Doctor, I want to talk to you about some of the lingering symptoms of COVID-19, the long haulers that so many of us have heard about.
You know, a lot of these long haul symptoms can be quite debilitating. The brain fog is actually not minor. People report that they have trouble concentrating, trouble with their memory. They're unable to work or go to school. So it's quite significant from what they had before.
What do we know about how many people are experiencing brain fog in terms of the numbers of people who have contracted COVID-19?
Recent studies said 1 in 3 people will have some type of neurological complication post-COVID-19, so that's quite high. And other data supports that too, that 75% of people that have recovered are still experiencing some type of lasting symptom, even 6 months, 9 months later. So even more reason to kind of prevent this illness from occurring by getting vaccinated and taking precautions.
I understand that Vanderbilt University Medical Center is looking into some of the digital treatments available to treat brain fog. Can you tell us about some of this research and what they're learning?
Yes, you know, with Vanderbilt, it's interesting. They're actually looking to see if video games can help improve that neurological or cognitive function in those people who are having brain fog. We already know from previous years that video games can help with hand-eye motor coordination, but I'm sure it can also help with some of those other things that that the long haulers have issues with, such as brain fog, memory, concentration difficulties. So it'll be interesting to see what the study shows.
Well, we'll be watching that closely. Dr. Parikh, thanks for your time.
Thank you.